Now, healthcare delivery at the Federal Teaching Hospital Birnin Kebbi has been thrown into uncertainty as nurses join nationwide 7-day warning strike. The industrial act aimed at pressing home their demands has raised serious concern over continued patient care and service delivery. Here's the report.
The usually busy wards and nurses' stations at the Federal Teaching Hospital Birnin Kebbi are now quiet, as nurses have withdrawn their services in solidarity with their colleagues across federal hospitals nationwide. The chairman of the Medical Advisory Committee, Dr. Ashuruladen Arugungu, expressed concern over the situation. While acknowledging the nurses' grievances, he appealed to the federal government to urgently engage the union and find a solution. He also called on the striking nurses to suspend their action in the interest of patient care and allow room for negotiation.
These are nurses that are on strike. Like every other profession, nurses have some of their grievances. They have outlined some areas that they want the federal government to look into. Some of these things is they are advocating for a upward review of their salaries and allowances. They are also looking at some policies of federal government that they think those policies also need to be reviewed. They are also discussing about issue of councils of this federal institution. For the past 2 years, we don't have a governing council.
On their part, the nurses are standing firm. Nurse Atta Kashim, secretary of the nurses union at the hospital, outlined their key demands to include improved working conditions, better pay, and more staffing to ease the burden on existing personnel.
It's a long-standing issue, actually. Some as far back as 2012, some has been as far back as 2016. The issue of our scheme of service is one of the reasons why we are embarking on strike. This was approved in 2016 as the National Council of Establishment in Mina. That is 2016. And up to now, that document is yet to be gazetted and to be circularized. And it's when the document is gazetted and circularized that MDAs and chief executive can act on it. So that is why we're calling on the federal government that it is time for that document to be gazetted and to be circularized so that it can be implemented by some of these MDAs and chief executive officers for our members to benefit.
As the strike enters day 2, patients and their families are growing increasingly anxious. Some fear their health will deteriorate without adequate nursing care. Hence, many are pleading for a swift resolution.
So we are facing a lot of challenges because of lack of nurses that are not around, and a lot of people have been discharged even though they are not even yet recovered. I'm calling to not only for myself alone, but for everybody and for the general public.
Obviously, I felt very sad because a lot of patients here don't know where to even start from. We were all stranded. Like myself, as I'm talking to you now, I'm just about to leave the hospital because the strike has affected a lot of people. In fact, because of the strike, if I'm not mistaken, about 2 people lost their life.
For now, the situation remains tense but hopeful. Talks are ongoing between the hospital management and the nurses' union as both sides seek a mutually agreeable solution. Meanwhile, patients continue to hope that normal services will resume before the strike escalates further.